Okay, so just to reiterate, genetic hearing loss, you're born with the gene, you have the hearing loss. It might be deaf, it could be just a partial hearing loss. Same thing with congenital. The difference is congenital means just born with it. So some congenital hearing losses are genetic, some are not. They just happen. Okay. Finally, the other type of sensorineural hearing loss I'd like to talk about has to do with what we refer to as a problem with the central auditory pathway. In other words, a pathway from your ear to your brain. Okay. All sorts of problems can occur. Different types of tumors, that's the most common. People can have strokes where they damage the auditory pathways. The most common type of auditory pathway pathology is what we call an acoustic neuroma. Acoustic neuroma, just like it sounds. An acoustic neuroma is a tumor which grows on the auditory nerve, just outside the inner ear, and so it's in the early stages in terms of pathways. This is a particular tumor which grows on the auditory nerve. It's benign, that it's not cancerous or anything like this, but it continues to grow and grow and grow. So if left untreated, it's going to grow into your brainstem, and it would kill you. So you have to take care of it. It's one of those things that if you didn't do anything about it, it would be pretty serious and be actually fatal. However, it is treatable. And usually the most common way of treating it is to actually do a operation where they go right through your ear, literally, and drill right into the temporal bone, that bone which is on your side of your head, to get to the tumor and remove it. Unfortunately, when this occurs, as in most cases, there's a few exceptions, but in the vast majority of cases, that you would be deaf in that ear after that. But it's considering the alternative, which is death, it's probably a pretty good idea to get that taken care of. So that's an acoustic neuroma. Again, there's some other things, congenital problems with the brain stem, strokes, other things that could cause problems, but those are very, very rare. So in summary, those are just a number of different types of hearing loss. Again, let's summarize here. Conductive hearing losses are hearing losses that have to do with the outer ear or middle ear. Sensorineural hearing losses have to do with the inner ear or auditory pathways. Okay. Now, how do we actually test hearing? Let's go. So if we're looking at our slide, this would be slide, well, actually, as far as we just talked about the information on slide 3, so let's go to slide 4. Before we actually get into that, there's one other thing I want to talk about, and that has to do with degree of hearing loss. And you can see that these are different types of, if you're looking at the chart, slight, mild, moderate, severe, profound. There's actually a moderately severe category as well, but I'm just trying to keep these particular 5 degrees so it's a little bit easier to hopefully understand. But a slight hearing loss is something that if you're an adult, you may not even notice you even have it. For children, though, it could be a problem in the sense that they might have difficulty hearing in the classroom, or learning is very important. So we do have that very slight category. And we do get concerned about it, especially if it occurs in children. Mild hearing loss is typically people, when they get presbycusis and it drops down to the mild category, because it's such gradual change, people often don't know they have that problem. They know they have trouble. People are not speaking up. People tend to be mumbly, that sort of thing. It's not them. I mean, it's always the person who's speaking, where in fact it's really the listener. But you don't notice it because it's such a slow onset. You might know people in terms of your parents or grandparents, where they might say, when people were younger, they used to speak a lot clearer than they do now. Well, they probably did before you had your hearing loss, but now you have that hearing loss. It does create some problems. Most people with mild hearing losses can benefit from a hearing aid. Moderate hearing loss, this is a little more unusual, but this would be somebody would have difficulty understanding even normal conversational speech. They could hear it, but it would be very, very quiet. Severe hearing loss, you wouldn't even be able to hear normal conversational speech. You'd have to shout before you'd actually understand somebody is speaking to you. Again, with these moderate and severe hearing losses, hearing aids are really a must in order to function. Profound hearing loss are typically people who are deaf. If you are deaf, usually you can be fit with a cochlear implant, powerful hearing aids, or you can use American Sign Language in order to communicate. So all three of those are options. Okay, now what I'd like to do is show you some of the instrumentation that we do our hearing testing with. First one is an audiometer. An audiometer is simply a device. I have one right here. Okay. With the audiometer, allows us to test people in their right ear and left ear, and there's always have a toggle switch on here somewhere on the audiometer where you can switch between the right and left ear, and you can see that the person who's the patient would be able to wear earphones. This way we can test one ear at a time. Okay? So those are the earphones. Notice that there's a red one and a blue one. The red always goes on the right ear. It's kind of like those red symbols that we showed you on the audiogram. Again, the blue one would then go on the left. But okay, the person is wearing their earphones, and we can just go ahead and test the individual. We can change the intensity of the sound and also the frequency. So let's go ahead here. Hopefully you can hear that, so I can press the test button, and then you can hear the tone. And again, I can change the intensity and the test frequency. And remember, the goal of the hearing testing using an audiometer is to try to find the softest or the least intense level for each one of these different test frequencies. And from that, we can then generate an audiogram, which I had mentioned before, where, just to review an audiogram, what it looks like. Okay, see if I can hold it up there. Again, there is a separate slide for audiograms on that. Again, the horizontal axis is the frequencies. The vertical axis is the decibel level. That is how intense we had to make the sound in order for the person to actually hear the tone. Then we can actually plot it using X's and O's, right and left, and that way we can get a chart of the individual's hearing. So that's the most common use of, or most common hearing test. There are other hearing tests or other instrumentations that we can also use. Okay. And what I think I'm going to be doing here is to go ahead, and we'll let you go off early today. Just a couple other things that I wanted to talk about. For the last test, we talked about, we'll try to get those returned. I'm not sure if I'm going to be able to go over it on Monday or Wednesday, because we do have, not everybody has taken the exam, so they have to complete the exam before I can return them to everybody. What I'm going to talk about next time is something called tympanometry.